Hi, I'm Dr. Justin Porter with Oklahoma Pain Management, treating mostly spine-related pain here in the Oklahoma area. We're going to talk today about facet-mediated pain, pain that comes from the facet joints in the lumbar spine area. Most people can have pain in the cervical, thoracic, or lumbosacral spine coming from the facet joints. This is pain that's typically characterized by an aching, throbbing, low back, burning sensation that is worse with twisting or arching the back backwards because that loads pressure on the facet joints. It's a common problem for both men and women. It tends to start to present more in the 40s, 50s, and 60s. And I'm going to show you on our model here what the facet joints look like and how they kind of rotate. So here we have a model of the lumbar spine. This is the front side. In other words, this part of the spine faces towards the patient's belly. This faces towards their backside. The facet joints are basically the result of each bone that connects to each other, and this allows for rotation and extension of the spine. These joints can become arthritic with age as people get degenerative disc disease. In other words, when these discs that normally act as the buffer cushions start to wear out and lose a little bit of their height, it creates a situation where there can be more friction on these joints, similar almost to like bone-on-bone arthritis that you may see in a knee. However, it doesn't typically produce large osteophytes. It can produce pain even just from a small amount of degeneration along these joints. When patients rotate side to side, as you can see, hopefully, on this model, the joints tend to start to bump into each other. Normally, in a normal scenario, these joints will glide over each other and move smoothly. However, in this case, with patients who have some facet arthritis, they may start to break down and get pain coming from that area. What we do to treat this is we take little needles and we numb up the nerves that run into these joints. There's a branch off of these major nerve roots that runs around and into the joint, and we can target those specifically using X-ray guided techniques where we place a needle down onto the bone at these levels and numb them up, so that then when the patient rotates or extends their spine, they don't feel the pain that comes from there. Typically with some numbing medicine and some steroid medicine, this pain will be alleviated for a period of a few weeks to a few months. However, if it returns, there are other options that we can do for treatment, including radiofrequency rhizotomy procedures. We'll talk about that at a later date.